Hey everybody, my name is Dr. Scott Giacomucci. I'm a trauma therapist and educator in Pennsylvania. And in this video, I want to talk a bit about the connection between trauma and self-hate. So I feel like trauma and self-hate really go hand in hand in many ways. And that in the aftermath of trauma, we can start to find ourselves really experiencing a lot of self-hate. So I wanted to make this video for a couple of reasons: to validate that self-hate often comes from trauma and is a symptom of PTSD and CPTSD, to offer some insight into how this happens and to provide some tools and ideas for working through this. So when we experience trauma, it can really leave us with negative views of ourselves, negative perceptions about ourselves. This is particularly true when we experience childhood trauma, that when we're children, we're less equipped in making sense of our experience and understanding why things happen. And so oftentimes when we experience childhood trauma, we come to blame ourselves for what happened. And we might go through our entire lives feeling like something that happened when we were a child was our fault. Even though we know intellectually that it could not have been our fault, it still feels like it was our fault. And these negative feelings and views about ourselves can really snowball and escalate into self-hatred. I like to say that no child is born hating themselves, that this is really something we learn along the way, that we learn this from our experience, from trauma, through neglect or abandonment, and that just like we learned it, we can always unlearn it as well, and instead learn self-love, perhaps, self-compassion, self-acceptance. So although self-hate is really connected and correlated with trauma, it doesn't mean that we can't change it, that we can't work on it, we can't bounce back from it and learn to love ourselves. One of the things that seems to happen when we experience trauma, especially relational trauma, is that we seem to internalize and take in the negative beliefs, the negative messages from an abuser or from a perpetrator. That if we have an abuser that tells us again and again and again that we're worthless, for example, over time, we start to really believe this about ourselves. And we start to have what we call an introject in psychology, and this little voice in our head that tells us we're worthless. It's almost like we've taken the message from the abuser and we've adapted it in our own mind and in our own voice. And it becomes a core part of how we experience ourselves and who we believe ourselves to be. So these internalized negative messages, many ways they don't belong to us. They belong to the perpetrators, to the abusers that planted them in our head, or that through repeated messaging or experience taught us to believe this about ourselves. And so in trauma recovery and trauma therapy, there's often a difficult and painful and complicated process of sorting out what is mine and what is not mine. And many times these negative messages, these negative beliefs that we tend to hold about ourselves after trauma, we might come to realize that they don't belong to us. They didn't come from us, that they started from a perpetrator or from an abuser, and that we've adopted them as our own at some point. That in order to try to make sense of the trauma, we started to believe that we were worthless and that we deserved it, or that we're a failure, or that we're broken, or that we're not good enough, or we're unlovable, or whatever the message is. And again, I think this is particularly true for childhood trauma, that in the example of neglect, for example, if a child repeatedly experiences neglect, emotional neglect, their parent doesn't show up and love them, validate them, provide for their emotional needs, it might be a lot easier for the child to start to believe that they're unworthy of love or that they're unlovable, because if that's true, then their experience with their parent all of a sudden makes sense. And we might come to change our beliefs about ourselves rather than changing our beliefs about our parent or about the individual that's impacting us. I think furthermore, when we're struggling with self-hate after trauma, one of the things that can contribute to that is that we might be angry at ourselves for allowing ourselves to be hurt, that we might feel like we caused our trauma or that we played some sort of role in contributing to our trauma taking place. And for the most part, when we experience trauma, it's by its nature, it's usually an experience that does not involve choice. We didn't explicitly and directly choose to be traumatized, to be a victim of trauma. Now, sometimes we might make decisions that leave us vulnerable to experiencing trauma, but we didn't choose to be victimized in many cases. And we might be left blaming ourselves for the trauma. And this can really contribute to that self-hatred. Beyond that, I feel like after we experience trauma, if we start to experience traumatic stress and the symptoms that come with PTSD and complex PTSD, the intrusive images and nightmares and flashbacks and the re-experiencing of the trauma, the reenactment of unhealthy relationship dynamics, the avoidance, the numbing behaviors, the arousal and reactivity, the negative beliefs, the negative moods, that all these different symptoms of traumatic stress can really change who we are. And we can really start to hate who we've become because of the trauma. We can start to feel like we've become somebody else, that we're not the same person we were before we experienced the trauma. And these symptoms of PTSD and CPTSD, they can really impact our behavior. They can impact our ability to show up in relationships and be the best that we can be. It can really leave us feeling disappointed in ourselves for missing opportunities in life or contributing to conflict in relationships or lost relationships or not seeking help sooner. We might really beat ourselves up for a number of different reasons. And this can really just compound and contribute further to the self-hatred that we might feel. Now, on top of all of this, the very symptoms of PTSD and complex PTSD include symptoms related to having a negative view, a negative perception of ourselves, feeling that we're a failure, feeling that we're worthless, a sense of shame, feeling like something is wrong with us, that we're broken, that we're undeserving. And so not only does the experience of trauma contribute to self-hate, but the actual symptoms of traumatic stress involve beliefs that can be connected to self-hate. And so there's really a cycle of self-hate that can form here. Now, many times when we're struggling with traumatic stress and trauma, those symptoms and that experience can really fuel other addictive behaviors or relationship problems or acting out or just defenses or behaviors that we engage in to try to protect ourselves from more trauma. And some of these behaviors can really cause other problems. Like if we're using substances or alcohol to try to numb the pain from the trauma, or if we're diving into workaholism or a gambling addiction to try to distract ourselves from the pain of the trauma, this can lead to additional self-hate. So some of the behaviors we engage in to try to numb the pain or to distract ourselves can even snowball into more and more self-hatred. So self-hatred and trauma go hand in hand, which means self-love and trauma recovery have to go hand in hand. That when we're engaging in a path of recovery from trauma or trauma therapy, that self-love, self-acceptance, self-worth, all of these themes have to be a part of it. That we have to come to learn self-compassion, acceptance, and love, and really start to see ourselves through these lenses. Now, it's a lot easier said than done. In reality, it's a practice. It's a daily practice, something that we have to work on a regular basis. That it's rare for us to be able to just make a decision one day to love ourselves. That we really have to work at it and incrementally love ourselves more and more each day. So self-love involves giving ourselves a break, validating ourselves, and understanding that when we take a look at our entire timeline, when we take a look at what we've been through, that some of our other behaviors might make more sense, and that we can have empathy for ourselves. We can have compassion for ourselves, that we had to struggle with and go through the things that we went through. So giving ourselves some grace, treating ourselves with patience, giving ourselves a break. And so another strategy and angle of working on self-love would be cultivating the things that we love about ourselves, starting to identify some of the things that we like about ourselves, and really focusing some of our energy there. If we really love that we're smart and intelligent, maybe we intentionally try to spend more time cultivating that positive quality of intelligence, allowing ourselves to learn and enjoying this part of ourselves. So cultivating things we love about ourselves and at the same time working on things that we hate about ourselves. Maybe we love that we're smart, but we hate that we're selfish, or that we hate that we struggle to be empathetic in relationships. And so if we're actively working on the things that we don't like about ourselves while working on and building and strengthening the things that we do like about ourselves, we can really be coming at it from both angles. Working on the self-hatred, reducing the self-hatred, increasing the self-love. Another suggestion and thing that I've heard and read that can be helpful is treating ourselves in the same way that we might treat someone that we really love and care about, or even better, if you have a pet, a cat or a dog or another animal that you really love and care about unconditionally, that we treat ourselves in the same way that we treat our pet. Of course, this only works if you really take care of your pet and address the needs of your pet and love your pet. And we know that not everybody takes care of their pets in the way that they should. But if you're someone that has a pet that you really love unconditionally, you make doctor's appointments for your pets, you take them to the vet, you make sure that they eat enough food and get enough exercise, and that all of their physical and emotional needs are taken care of. This might be a helpful way of working on self-love, is that you reflect on the energy that you spend loving and taking care of your pet, and redirect that same energy inward and take care of yourself in a similar way. That many of us will make an appointment for our dog to see the vet as soon as our dog starts to have any symptoms of some sort of illness, but we won't do the same thing for ourselves. We won't make a doctor's appointment for ourselves when we feel bad. Or we'll give our dog a break when it's, feeling lonely and whining and crying. We'll be patient with our dog, but we won't give ourselves that same break when we're feeling sad or emotional. And so this might be a helpful change in perspective, that if you're someone that really loves and takes care of your pet, to really redirect and give yourself the same love and care and attention and patience. So in trauma recovery, we've got to work on these feelings and thoughts of self-hatred and try to transform that into self-love and self-compassion and self-acceptance. I hope you found this video useful. If you did, I encourage you to subscribe to our YouTube channel here, like the video, leave a comment about what really struck you as important, or something else that I forgot to mention that you think connects to the topic of trauma and self-hatred, trauma and self-love. And my hope is that these videos are really useful for anybody recovering from trauma and anybody working with individuals recovering from trauma.